Hello, I'm Dean Beggs. I'm doing a presentation on hemophilia. I picked this I picked hemophilia because my friend had it and I wanted to learn about it and I saw him suffering from it. That's why I chose this topic. So I'll tell you a little bit about this disease, hemophilia. Here we go. Hemophilia, what is it? It's a bleeding disorder where the blood does not clot properly. Um, Lacks proteins called clotting factors, and clotting factors are proteins that work together to clot blood. This is why the hemophiliacs lack this, and this is why they bleed excessively and longer. And people that don't have hemophilia have these proteins called clotting factors, which stops the bleeding. So this is why they bleed longer and they bleed more. And hemophiliacs bleed for a longer time due to what I just said, the proteins that they don't have and normal people do have. Hemophiliacs bruise and get cuts easily compared to people that don't have it. It has to do with the circulatory system and the proteins that they don't have. If someone touches them, they can bruise. That's how delicate their bodies are. You can tell right away if someone has hemophilia. You'll see that they have bruises, cuts, and then you'll see swelling. It's ridiculous. Hemophilia is a hereditary disease. It runs down the family. People should be aware of their blood diseases in families. So usually, if you're having a kid, you should have an idea like they could have a blood disease. So it stays with the person their whole entire life, from when they were born to when they die. People don't find it right away, but they still have it, but they may not know that they have it. But eventually they'll find out. It's more common in males than females. Females usually get hemophilia type C, and males get A or B. It's rare to have a female have hemophilia. It gets passed down from the mother to the daughter, to the mother to the son, due to the X chromosomes. The X chromosomes make it so that the father won't give it. It has to do with the mother, the X chromosomes. Doesn't have to do with the father, so the mother always gives it to the son or daughter, and it's really rare in females. 1 in 5,000 males have it in worldwide, so it's a rare disease, which is a good thing. So there's different types of hemophilia. There's several different types. Hemophilia A is the most common and the most severe, and it's caused by insufficient clotting factor, VII, which is 7, I believe. And hemophilia B is the second most common, and that's caused by insufficient clotting factor, similar to hemophilia A, just a different clotting factor. Hemophilia C is the least severe, but it's caused by insufficient clotting factor, XI, which women tend to have compared to men. Like I said before, hemophilia comes from the XX chromosomes, so the mother passes it down to the son or daughter. It doesn't come from the father. Hemophilia affects the whole body as a whole. It affects literally everything. It affects the hemophiliac to the point where the hemophiliac has to watch what they're doing. They can't participate in physical activities just in case if they fall, it can be really bad. It's life or death in severe cases. So, hemophiliacs can bruise from just simply walking. It just depends on what kind of hemophilia, or if they have hemophilia C, A, B. It just depends on the severity. The most common factor is they can bleed out of their nose. That's the most shared symptom out of the symptoms. So, and hemophiliacs can bleed out of their mouth for no reason at times, which is weird. Females have a heavier menstrual cycle compared to females that don't have hemophilia. Hemophiliacs, they can bleed internally and externally. It all depends. They can bleed internally for no reason or externally for no reason. Joints and muscles can be affected. they can bleed, and it can cause permanent joint deformity and dysfunction, and that's usually long term. Hemophiliacs that have it long term usually experience the joint deformity and the dysfunction. And by long term, I mean like severity wise. And brain bleeding, it can lead to brain damage or even death. And if they start bleeding in the brain, it'll affect the central nervous system, making them have permanent brain damage or even death. They can bleed for no reason. Their bodies are super fragile. They gotta watch everything they do. They gotta think about every exercise or activity that they participate in. It's a process for them. Hemophiliacs. It affects the skin, the integumentary system, due to the bruise and cuts that they get in the dermis, which is visible to other people. The muscular system is also affected. It bleeds, and it can cause weakened muscles, and the muscles can actually be deformed if they're experiencing symptoms for a long period of time, and it can reduce mobility just because they get weaker and weaker as they keep bleeding, and it damages the muscle. Blood vessels in the joints rupture, and it can cause disfigurement and dysfunction in the joints, and which affects the skeletal system. It just messes up everything, and that has to do with the blood. And that's what hemophilia is. It's a blood disease. So the circulatory system is also affected. That's the main thing that's affected due to the blood. It doesn't clot, and they get hit and they'll bleed longer than others, and they'll get cut open easier compared to people that don't have hemophilia, and it can cause blood loss if they get hit and they bleed. So that's important for them. Digestive system, that can be affected by the gastrointestinal bleeding. That can start bleeding the gastrointestine into the digestive system, and it can cause for hemophiliacs to cough up blood. For them, they'll get pale, they'll feel weak, they'll feel stomach pain. So that's the most common for from the digestive system getting affected, the gastrointestine bleeding into the digestive system. And the urinary system is affected by the kidney bleeding. It can bleed for no reason, just out of nowhere, and it can get into the bladder, causing an infection and feeling pain in the stomach area. So hemophilia symptoms. Bleeding and bruising easily, obviously, which is huge. So they'll bleed longer than others, like I said, from the lack of proteins that the lack of proteins hemophiliacs have. So they'll just bleed and bleed compared to normal people. Pain and swelling in joints, they'll experience that. And then infants, I'm sure they experience irritability. I'm sure they experience irritability because they don't know what's going on. Who wouldn't be irritated with all these symptoms, you know? The most shared symptom is the random nosebleeds, and if you feel these symptoms these are the symptoms I'm going to list off for the hospital indicators. These are the severe ones that you should get to a hospital if you experience these, which would be if you have headaches over and over again, if you have extreme fatigue, you're just feeling tired and constant vomiting, neck pain, and then if you got double vision, you should get to the hospital. Those are the severe symptoms. So, and there's several ways of identifying if one has hemophilia. The blood test will show if one has a blood clotting deficiency, if they do or don't, and then you can predict it. The blood test will predict if one has hemophilia or if they don't, if they have the blood clotting deficiency. And people should be aware of their family history of blood disorders, just so they know that there's a chance that the kid could have a blood disorder by just knowing the family history. If someone else had a blood disorder, there's a good chance that the kid's going to have a blood disorder too. And circumcision, that's a good way for doctors to know. If it's usually a boy, that has hemophilia, so it's a good way to identify. It's a warning sign. If they decide to do circumcision, they'll bleed longer and they'll bleed more for a boy. So that's a good way. It's a warning sign to see if one has hemophilia. The doctor can usually tell. So treatment for hemophilia. There's really no cure. You just gotta try to minimize the symptoms as best as you can. Try to live with the disorder. Hopefully they'll find a cure soon. All you can really do is just stay healthy, preserve the body, physical health, eat healthy, exercise. Well, not physically exercise. Do what you can without getting hurt. And then there's the Rice method of just rest, ice, compression, elevation. They shouldn't participate in physical activities, which could lead them to go. Bad things can happen if they participate in physical activities. They should definitely avoid that. And the two most common pharmaceutical ways of just minimizing the symptoms would be desmopressin and antifibrinolytics. They're both two pharmaceuticals. These agents will help form fibrin clots by blocking the effects of plasminogen activators. So, but if someone uses these for a long time, they can have problems in the kidney and liver. So that's the downside of using using chemicals to help with the disorder instead of just. Some people have to, depending on the severity, but if you don't have to, it's better just to eat healthy, try to stay healthy without using those. So, yep. And thanks for listening to my presentation. And here's my references. You have a good one.